Let's now come to another of our session highlights. Olivier Sitbon, welcome. And you were in a session about the stratification of PAH. You're talking particularly about the stratification of risk. Give us the highlights of that talk.
Risk stratification is very, very important in patients with PAH. It is a strong recommendation from the guidelines to assess the risk just after the diagnosis to decide what kind of treatment we have to initiate in the patient. And also regularly during the course of the disease, we have to reassess the risk in order to modify, to escalate the therapy in those patients. There is a very famous table in the guidelines with some parameters, clinical parameters, functional class, also exercise variables like the 6-minute walk distance, and also imaging with of the right heart with the echo, and also hemodynamics, which is very, very important, and biomarkers like BNP and NT-proBNP. And according to the certain threshold, for example, for functional class, it's functional class 1 or 2. Is associated with a good prognosis. So this is the green column, associated with a low risk of death within a year, less than 5%. According to certain threshold, we can assess the risk. For functional class 1, 2 is good, 3 is intermediate, between 5 to 10% risk of mortality within a year, and class 4, the most severe patients, that patient with the high risk of death within a year, more than 10%. However, we cannot assess the risk only with one parameter. We have to do a multi-parameter assessment, and it is recommended to assess different parameters to do the right decision regarding the treatment. In 2017, 3 papers have been published to validate the guidelines, the risk stratification guidelines that have been elaborated only on the basis of expert opinion. 2 of those papers have been published in European Respiratory Journal and 1 in the European Heart Journal. And those data come from 3 large registries, one in Sweden, another one in Germany and other countries in Europe, and a third in France. And just to say some word about our study we published on the French registry, we look at the number of low-risk criteria present at baseline and achieved at follow-up to know what would be the outcome of those patients. And we observed that when we took 4 low-risk criteria, functional class 1, 2, walk test more than 440 meters, a cardiac index of more than 2.5, and a right arterial pressure of less than 8, the more the patient have low-risk criteria, the best was the prognosis. And for patients having the 4 low-risk criteria achieved at follow-up, the survival was very, very excellent, with more than 90% survival at 5 years, which is very, very good.
And very reassuring news to give to patients, obviously.
Exactly. If we can treat correctly the patients, usually quite aggressively, in order to improve the clinical status, to improve the exercise capacity, and also to improve hemodynamics, we can expect a very long life expectancy in those patients.
So a very important study there, and of course that is available on live at ERS Plus. But I know that you're also presenting another paper.
Yeah, yesterday I presented the paper of the application of this method, the number of low-risk criteria achieved in a randomized controlled trial. So we chose the Gryphon study. The Gryphon study was an event-driven study that demonstrates that selexipag, when either alone or added to 1 or 2 drugs, was superior to placebo in terms of morbid mortality. We published that in 2015 in the New England Journal of Medicine. So we took this study. We took the database and we look at the number of low-risk criteria achieved in that study to know if this may also predict not the survival but the disease progression or the absence of disease progression. And we observed that exactly as we showed in registries with the true survival, we also observed that the more we have low-risk criteria achieved, the less patients experienced morbid mortality events.
Great. Okay, so some very important data there. And when did that appear in the New England Journal?
Sorry?
When was that in the New England Journal?
Not that one. The previous one, the complete study of the Gryphon study was published in 2015 in the New England Journal.
Okay, so if you work in that particular area, and I know PAH is a condition that's mostly treated by specialists, you'll need or want to watch that on live at ERS Plus.